While some countries have already approved vaccinating teenagers, others are still struggling to get their hands on the shots. We will take a look at vaccine inequality. Hello, I'm Anand Naidu, and this is The Heat. We begin the show in India, where the coronavirus outbreak appears out of control. The country has been averaging well above 300,000 new cases of COVID-19 every day for a couple of weeks, and the health system has reached desperation. At the current pace, India could eventually overtake the United States as the country with the most cases of COVID-19. And although India is the biggest manufacturer of the coronavirus vaccine, fewer than 3% of its population has been fully vaccinated. Earlier, I spoke with Achal Prabhala, a researcher in India and coordinator of the Access IBSA project, which campaigns for access to medicines. I started by asking him about the COVID situation there.
It's absolutely hellish, actually. I've never lived through anything like this. Every day brings news of a loved one or a much loved one who is either in hospital or worse, or dying or dead. The stories are just too many to take, and it's the same for everybody that I know, and everyone that I know is also either infected or getting out of an infection. The scale of it is just unimaginable, and I've never lived through anything like this, and I hope I never do again.
You know, we saw these heartbreaking pictures. We've been seeing them every day on our television screens of people trying to get into hospitals, trying to get hospital beds, people who are struggling to get oxygen, to buy oxygen. What is that situation like right now? Is it eased, or are these hospitals still under very heavy pressure?
All hospitals, I think, everywhere in India are under heavy pressure. I think they're under greater pressure in places like Delhi, where the need seems to be much greater and the spread of infections has been, I think, more severe. But one of the aspects of this tragedy is just how many deaths were preventable. If we assume that the surge in the coronavirus cases wasn't preventable, which is also not entirely true because there were relaxations and I think an irresponsible encouragement of large gatherings that contributed to the surge, certainly. But the fact is that even with the number of cases that we have, the mortality rate in India is entirely induced by the failure of the Indian health system to treat people. So the people who are dying aren't actually dying of COVID in the sense that they wouldn't be dying if we were in Sweden. They're dying because the hospital infrastructure and the public health system actually doesn't have space for them. We don't have enough oxygen for them, and the entire health system is just buckling under the pressure of the demand. And so people are dying from a lack of basic care, which is really sad.
You know, as you say, the system has become overwhelmed, and you mentioned the city of Delhi. And most of the pictures we've been seeing are actually from Delhi, but are there regional differences? I mean, is the situation the same in the southern part of India? Because there have been some reports that is not as bad in southern India as it is in the north.
I think that there's a marginal difference in southern India. It's not quite as bad. I think that there's a greater difference in northeast India, where it's probably slightly better than it is in South India. But the fact is actually that it's pretty bad. I live in Bangalore, and in Bangalore, you can't get a hospital bed for love or money. And it's exactly the same kinds of concerns. The spread of infections is actually still going up, and this is true even in Bangalore, where I live. And in fact, we have now the highest active caseload, which is basically the largest percentage of people who are infected with COVID in any city in this country at the moment, and that's horrifying.
Now, there have been calls for a national lockdown to put the brakes on these escalating numbers. There was a lockdown actually at the beginning of the pandemic, and that seemed to have worked because the numbers were very low at that point. How is the federal government, and especially the Prime Minister Narendra Modi, responding to these latest calls?
It's not clear whether they will go in to institute a national lockdown like they did last year, like we had last year, like we endured, which was very, very difficult. And I think part of the reason that they wouldn't is that this is going to chip away at the Prime Minister's party's popularity in this country, which is something that they obviously care a lot about. The problem actually with the lockdowns extends though beyond merely a political question, and it's actually a question of the fact that we know it's one of the two things that work to keep infections down, right? So I'm in Bangalore, for instance, we have a military-grade lockdown at the moment. So right outside my house, for instance, even at 10:30 at night, There are military police who are guarding intersections to make sure that traffic doesn't pass and that people aren't leaving their homes. This kind of a lockdown, even in just the state or in the country, affects a severe toll on working class and poor people. So people who need a daily wage or people who are too poor to actually benefit from any kind of state welfare, which in fact doesn't exist and barely reaches them, suffer tremendously during a lockdown. But the problem is that there's one other thing that can prevent the kinds of resurgences we've seen here, and that's mass vaccination. And on that count, we've miserably failed, and we're now in an acute shortage of vaccines.
Okay, let's talk about the vaccination rollout in India. At present, there are only about 2.5% of people who've been fully vaccinated, and at least 10% of the population, the eligible population that is, who've had at least one shot. Has the federal government or even regional governments, state governments talked about any kind of plan to increase these numbers?
Anand, this is the heart of the matter. We do not have the same rate of vaccinations as the United States does or the United Kingdom does, and are therefore not experiencing the same benefits of having that rate of vaccinations, which is that you can open up your economy fairly safely, and that at least for now, it seems that you're protected from these virulent resurgences of the coronavirus. Now, but how we got here is another question altogether, because last year there were large access contracts that were given out by one Western company, AstraZeneca, which came to fruition. We started producing those vaccines in January. Those vaccines, however, were not actually all for us. So they were enough to vaccinate about 500 million people, 1 billion doses. Between 50 and 60% of those vaccines were contracted to 91 other poor countries, or about a third of the world's population, because all these vaccines were meant to do for half the world's population. So it was inadequate to start with, and it was always going to be a mess. But I think even the WHO and Gavi and these organizations that ran this scheme to provide vaccines to poor countries around the world underestimated how much of a mess it would become. What we've done is to usurp vaccines that had been contracted to these other poor countries, and we're now using them for our vaccination program because of the catastrophic surge and the need in this country. But that's still not meeting our need, and that's partly because the government only really woke up to the fact that we have 1.3 billion in the country in terms of people, and that we need these vaccinations to start in about January. And that's very, very late to be realizing the kinds of vaccination needs we'd have and trying to fix that. By the time they started fixing that, we're already in this crisis, which makes it more difficult only to fix. We have a couple of other vaccines coming online. There's Covaxin, which is an indigenous vaccine, which is being produced in much smaller quantities. But we're now trying to ship that out and share that technology with a couple of other Indian firms so that the quantity of that vaccine can be increased. It's a perfectly good vaccine. In a couple of months, we'll have hopefully very large supplies of Sputnik V, the Russian vaccine. And with that, it's possible that there might be some sort of an ease in the situation with vaccine shortages. But it's a very bad situation, and it's an unlikely situation, I think, for the country that is supposedly the world's largest vaccine manufacturer to be in at this stage.
What about that decision that was taken by the WHO to approve emergency use of the Chinese Sinopharm vaccine? Does India have any plans to import that vaccine? How big a difference will it make?
Absolutely not. It would make an enormous difference. So there are two viable Chinese vaccines that are in large supply across the world in countries with very advanced regulation systems like Brazil and Turkey and Argentina and Indonesia. The Indian government has certainly not made any moves towards opening up talks with either Sinovac, which is a private company in China, or Sinopharm, whose Beijing vaccine is the one that the WHO just approved. I think this is an incredible mistake. I'm not necessarily sure why private companies aren't doing this either, reaching out on their own, because both the Chinese firms, Sinopharm and Sinovac, have shown a great willingness to be able to not only supply doses in large quantities, but also transfer their technology in order to set up manufacturing bases that are co-owned by an entity in India and an entity in China, and they've done this literally everywhere that they have sold to, like Brazil, Turkey, Indonesia. The United Arab Emirates has a huge factory that's coming online soon. this could have been a very good solution had we not been probably locked or caught up in a territorial dispute about a plot of land that humans have tried to avoid living in for the last 2,000 years, which it seems as a result of which we are not engaging around these two rather good Chinese vaccines.
Achal Prabhala, thanks for joining us.
Thank you, Anna.
Okay, let's focus now on the situation in Brazil and the United States. Here in the US, the Food and Drug Administration has authorized the emergency use of the Pfizer vaccine to people aged 12 to 15. Nearly 58% of adults have received at least one dose, and 34% of the entire population is now fully vaccinated. The result? A sharp drop in cases. The 7-day average fell under 40,000 new daily cases for the first time since last September. During the winter peak, the US registered almost 250,000 new infections per day. To continue our conversation on the COVID-19 pandemic, let's bring in our panel. From Rio de Janeiro, Nelson Franco Jobim is a journalist and academic lecturer. From New York via Skype, Hilary Brick is a senior health and science reporter for Business Insider. And Dr. Krishna Udayakumar is the director of Duke University's Global Health Innovation Center. Welcome to all of you. Nelson, let's start in Brazil. That's another country with escalating numbers. What is the situation there right now?
Well, I've just received the numbers for today, and the average death of the last 7 days has fallen below 2,000 deaths for the first time in 55 days. So that's good news. Both the average number of deaths and cases are still at a very high level. We have more or less 61,000 cases a day, and but the situation has improved slowly. The vaccination is not very fast. Brazil doesn't have, at the moment, Brazil needs ingredients from the vaccines. We are expecting them from China. And President Bolsonaro has criticized China, so many people are afraid that we may not be at the head of the queue to receive the Chinese ingredients to make new vaccines. We have I think 25% of the population has received the first doses, and 8.5% the 2 doses. But we have overtaken the United Kingdom. We have some 55 million doses administered so far, and we expect that things will improve as the vaccination process goes ahead. But it's still slow. We expect it to be much faster. Brazil has immunized more than 100 million people in 3 months with the flu vaccine. And so the National Health Service is prepared to do that, but at the moment, we don't have enough vaccines in Brazil.
Nelson, that first number that you mentioned, the number of deaths in Brazil, as you point out, it's going down. What's the reason for that? Is it just because more people are getting vaccinated, or are there other things that Brazil is doing to bring those numbers down?
Well, many states adopted measures of lockdown. Brazil has never had a complete lockdown, but many states, because April was the worst month with more than 82,000 deaths in Brazil. And so many states, particularly in the capitals, where the ICU beds were more than 90% occupied. In some places, there was a waiting list for ICU beds. And so there have been many measures taken by local governments and state governors. But the federal government, President Bolsonaro, does not support these measures. He thinks that it's bad for the economy. And so we have this situation in which the federal government does not help on lockdown measures. And this is a very difficult situation. But now, fortunately, both cases and deaths are going down still, but they are still at a very high level.
Dr. Krishna Udayakumar, here in the United States, the number of cases is going down. In fact, right now we have almost half the population that's been vaccinated. This is what Dr. Anthony Fauci, who is the country's foremost infectious diseases expert, had to say. Let's listen.
I hope that next Mother's Day we're going to see a dramatic difference than what we're seeing right now. I believe that we will be about as close to back to normal as we can.
So Dr. Fauci there, Dr. Udayakumar, telling us that we will get back to normal in about a year. So does that mean we'll still be wearing masks, we'll still be distancing socially for another year, or is he being overly cautious here?
Yeah, I think what Dr. Fauci was talking about is something close to normalcy. Of course, it's not a switch that you turn on or turn off. There's good news in the U.S., largely driven by the rates of vaccinations, that we have got now 116 million people fully vaccinated, 153 million with at least one dose. So that's 58% of adults. So all of that is allowing us to start opening up in very small ways and move forward. The key here is that as rates of vaccinations go up, the overall population risk comes down. So that should allow us to ease some of the restrictions in an evidence-based way, and also allows us to show people that there are incentives to continue to get vaccinated because it opens up access to personal freedoms. It allows us to do more things in more normal ways. So I do think it's going to be month by month a bit of reopening and feeling our way through by making sure that we're still doing surveillance testing, that we're still putting in place all of the other measures that we need to. But I think things like masking in public spaces and outdoors, if you are distanced, don't have to happen anymore. The CDC has come out with some practical recommendations. So I think we are well on our way to a phased easing of some of those restrictions.
So as you say, we're opening up in a small way. What are the major risks right now? Is it the fact that not enough people have been vaccinated?
That's certainly one of them. We know that the risk is still high. We're not out of the woods by any means. The other risk, of course, is that we don't know what's going to happen with new variants that might emerge here in the US or anywhere around the world. We've seen what's happened with variants that have emerged in the UK, in Brazil, in India more recently. And we hope that our current generation of vaccines will maintain immunity against emerging variants, but we don't know that. The second thing we don't know is how long the duration of immunity is going to last with our vaccinations. That's something we're going to have to monitor over the coming months. So there are potential mechanisms by which we would need new booster doses of vaccines going into this fall or winter, or based on new variants of concern that might pop up. So while we're in good shape with vaccinations now, we do need to make sure that we are cognizant and watching for things, whether it's duration or variants. But it's also really important that we step up and start playing a stronger leadership role around the world, because our health will not be safe so long as this infection, this virus rages in other parts of the world.
That's right. We have heard no one is safe until everyone is safe. Hillary Brick, Dr. Fauci also said this week that he believes the CDC should start loosening some of the restrictions here in the United States, including indoor mask mandates. It does seem a bit confusing because last week we did hear that it was okay to go outside without a mask, but now he's talking about what happens indoors. Have we got to the point where vaccinated people can forego masks altogether?
I mean, I don't think you can really give that kind of a blanket recommendation at this point. I think it's really going to depend on where you are and what the situation is where you live. I think when Fauci talks about relaxing masking indoors for vaccinated people, what he's really saying is as time goes on and as more people get vaccinated, infection rates come down, you will see the CDC and, other public health authorities coming out with more relaxed guidance along the lines of what Krishna was just talking about. But I think, one of the things that experts talk about is looking at the vaccination rate where you live. So experts have said 70%, 80%, something around there would be great to have. And then also daily new cases and hospitalizations. And as we know, that's not throughout the pandemic, those cases and hospitalizations have waxed and waned at different points in different areas of the country. So the U.S. is such a big place that it's hard to give a recommendation for everyone everywhere at the same time.
But Hillary, insofar as those people who are being infected even now, is the situation being managed now in the United States? Is it under control as far as people who are being hospitalized, people who are getting infected, and what they face out there?
Yeah, I mean, in general, I would say that that's the case. Things are getting better as more people get vaccinated and as the protection ramps up. Of course, we do still have, like with any vaccine, breakthrough infections where people get infected after vaccination. But what they're finding is overwhelmingly, when people do have a breakthrough infection, it's milder, and they're also probably less likely to transmit it to someone else. So, you know, things are trending in the right direction, but that's not to say that, you know, there aren't people who are getting sick and there aren't young people who are getting sick, because that's happening more and more as more and more of the older population is already vaccinated.
Nelson, we heard from our guest in India at the beginning of the show about the Chinese vaccine being used in many countries, including Brazil and other Latin American countries as well. In fact, looking at some of the numbers, more than half of the 150 million shots in the 10 most populous countries in Latin America have been from that Chinese vaccine. How important is all of that for the continent?
Well, that's the vaccines that are available for us. In Brazil, I think that more than 80% of the vaccines are the CoronaVac vaccine, which is the Chinese vaccine, which was bought initially by the government of São Paulo against the intentions of President Bolsonaro. And now we are expecting more ingredients from China so that we can have more vaccines. But the federal government has just announced that they bought 100 million doses from the Pfizer vaccine, but these doses will arrive by October. So there is still some way to go before that.
Dr. Udaya
We still
Kumar,
depend on the Chinese vaccine, basically.
right.
Sorry.
That's fine. Dr. Udaya Kumar, the United States currently leads the world in the number of cases, 32 million, as well as the number of deaths, which is 580,000. But there has been a study which was published by the University of Washington, which estimates that that number could be much higher. Here's Dr. Fauci again.
We've been saying, and the CDC has been saying all along, that it is very likely that we're undercounting. You know, the model says that it's a significant amount, as you mentioned correctly, 900,000. That's a bit more than I would have thought the undercounting was. But, you know, sometimes the models are right on line, sometimes they're a bit off. But I think there's no doubt, Chuck, that we are and have been undercounting.
So, Dr. Udaya Kumar, what is your sense of the numbers? I mean, talking about a number like 900,000, that's a bit of a shock to the system.
That's right. I think we know that there's been an undercount almost everywhere in the world relative to the number of cases as well as the number of deaths. We don't have great information from China from what happened with the initial surge, so we don't really have a comparison there. What we do know is in the US, we can track fairly well and transparently excess mortality, and that's part of what this modeling is based on. We also know that the numbers in Brazil are likely a significant undercount, and we know that in India, both the cases and deaths are significantly undercounted as well. So the burden around the world has been very significant, and what we've seen is that it's a very dynamic situation. So like what happened in Brazil several weeks ago, like what is happening in India now, when you get to the tipping point and health systems start to collapse, the rates of death are really going to skyrocket beyond what health systems can handle and beyond what our statistics can really track in real time. So that's what we're seeing here, is that people are trying to do their best. In some instances, there are incentives for governments not to report accurately. So that's also built into what we're seeing globally.
Hillary, of course, there are people who are very keen for their lives to get back to normality of some kind, and part of that is getting onto aeroplanes and flying off on vacation onto their vacations. Now, we have some European countries which are talking about a vaccine passport, which they believe will make international travel a lot easier. Is that likely? I mean, what are we going to see?
Yeah, so both in the EU and the UK, we've heard a lot recently about these ideas of a digital certificate, for the EU, something that could either be a negative test or proof of vaccination. In the UK, the NHS, I believe, is rolling something out next week where you can have an app that shows that you're fully vaccinated through your provider. And I think, just as we've seen all along throughout the pandemic, any additional layer of protection can help, right? Like, masks help, distance help, tests help. So any additional things you can do before you get on a plane to say, hey, the chances that I have this virus and I'm going to spread it around to either the people in the country I'm traveling to or the people who are not vaccinated when I come back home, the better off it's going to be. Not going to be perfect, but I definitely think it will help.
Krishna, here in the United States, the Food and Drug Administration, the FDA, has approved the vaccine, as I said earlier, for young teens, 12 and older. How big a game changer is that?
I think it's important because it shows us that we're going to continue to roll out new evidence, and seeing the emergency use authorization for 12 to 15 is a significant step forward because it allows us over the coming months to make sure that we're starting to reach down into lower and lower populations. It's going to make school safer in the fall. It's going to make summer camps safer over the summer. So all of these are paths forward, and there are clinical trials now underway of 6 months to 11. So by the end of this year, we will likely have that data, which, if it's positive, could lead to emergency use authorization for almost the entire population. And we know that to reach anything close to immune-mediated or vaccine-mediated herd immunity, we're going to have to think about reaching the entire population.
Nelson, very briefly, what about the vaccination rollout in Brazil? 35 million people have now been vaccinated with at least one dose of the vaccine. Some states have actually suspended the use of the AstraZeneca vaccine. That's after a pregnant woman died in Rio de Janeiro. But what is the situation now?
Well, they suspended vaccination of pregnant women, not all the people. Today I was listening to the CSIS podcast, and the people who are being interviewed said, maybe you should tell the young people that if they are vaccinated, they can have sex. So this may be an incentive for youngsters to get vaccinated.
Hillary, very quickly, what about those people in the United States who do not want to be vaccinated? I mean, it's a sizable number of people, and there are fears that the number is so high that the country will not actually get to herd immunity.
Yeah, I think, again, time will tell because we've seen throughout the pandemic how people who are vaccine hesitant, or one of my favorite scientists at the National Institute of Health, Minha calls them vaccine inquisitive people. So they really just have a lot of questions that they want to get answered before they get vaccinated. But we've seen how those people can often be convinced and go on to get vaccines. So I think it's just going to depend. And then there's also a lot of great incentives happening right now. In Alabama, the Speedway is offering people a ride around the track if they get vaccinated. In New Orleans, there's a program where you can get a free pound of crawfish. So there's a lot of new creative things happening.
Okay, well, thanks to all of you for being with us. Time has caught up with us. Thanks for being with us. That is it for this edition of The Heat. I'm Anand Naidu in Washington, D.C. Thanks for watching.